I want to see if you can guess the first supplement on the list. This supplement is one that many people take, usually to help with joints, to help with joint health, to help with arthritis. You might have seen even commercials on TV for it. Do you know what I'm talking about? Well, I'm actually talking about turmeric. That's right. I have a whole video on turmeric. I will make sure I link it here. You can learn more. But turmeric is actually a supplement that potentially could cause liver damage. Now, I'm not here to say the 6 supplements that I mentioned, number 1, in this video, they're not the only supplements or vitamins or herbals, etc., that can cause liver damage, okay? These are just 6 that many people use. Number 2, I'm not saying that by taking these supplements, you absolutely will have liver damage. I can't say that either. But number 3, and probably the most important, is I want you to know that these supplements may cause liver damage because more and more people are taking them for different reasons. So number 1 is turmeric. Keep that in mind. Guys, I'm Dr. Jen. It is good to see you. I have 5 more supplements for you. The next one, see if you can guess this one, is a supplement that a lot of people take for energy. They want increased energy. And by the way, many of these supplements, many people take for different reasons, not just the 1 or 2 things I'm saying. But for this one, energy tends to be a reason why people want to take it. What is it? It's green tree extract. Yeah, that's one that I've actually been hearing more and more about over the last few years. A lot of people will take that also to sort of improve or maintain health, etc. But energy is one thing that it is touted for. This is another supplement that can potentially damage your liver. You should know about this. Now, before we get to the 3rd supplement, let me just sort of let you know that when it comes to herbal and dietary supplements, they're not regulated the same way that medications are regulated by the Food and Drug Administration. And what that means is that, well, sometimes we don't exactly know all the ingredients in a pill of a particular supplement on the market or online, etc. We may not know the exact quantity or amount of active ingredient, and it's possible that there can be what we call interproduct variability, that from pill to pill, there can be literally different amounts, okay? What I would also say too, and I want you to keep this in mind, is that while, and I believe in natural remedies, many people consider these natural remedies. We have to remember that the word natural, or this idea that it may be considered natural, doesn't actually mean that it is safe. That's the other thing to keep in mind. And remember that something that's natural out in our environment, whether in the plant form, etc., when it becomes into a pill form or supplement form, doesn't actually mean that it's still maybe considered natural or safe, right? Sometimes the concentration of these active ingredients is a lot higher in the supplement form, or maybe too high for us, or other things. I mean, you get my point, right? It's not just as simple as vitamins and supplements are natural and thus better. And that logic is not necessarily going to keep you safe. Now, we do use vitamins and supplements for many different things in medicine, but I'm telling you this so that you talk to your doctor and tell your doctor about what you're taking. Do not assume that it is safe. And that it is appropriate. All right, next thing. All right, this next supplement is a supplement that a lot of people use for hot flashes. Okay, what am I talking about? I'm talking about black cohosh. This is a supplement that can potentially damage the liver, okay? The next supplement is one that I'll have patients ask me a lot about when it comes to heart health, and in particular when it comes to, say, their cholesterol. Maybe they don't want to take a statin, or they want to get their cholesterol down. What supplement may you think about that has been touted as something that may help with cholesterol or heart health? Well, what am I thinking about? I'm thinking about red yeast rice, another supplement that may potentially affect or damage your liver. And once again, this is going back to, okay, so when you're talking, we have got one more, so don't go anywhere. But when you're talking to your doctor about what you are taking, we want to know not just the medications that you're taking, okay, not just the prescribed medications. We want to know over-the-counter medications. We also need to know supplements, vitamins, dietary, herbal supplements, and things like that. This is very, very important. The other thing I would say too is that sometimes it feels like the wild, wild west when it comes to supplements and vitamins. Because these are not regulated like medications, there can actually be a lot of variability between companies and organizations that are making these products. And we just don't always have the studies and the data to prove that, say, the manufacturing and the ingredients, etc., are consistent, are safe, blah, blah, blah. Again, I'm not saying that they are bad. What I'm saying is that these are the caveats that you need to know about and why you need to tell your doctor. Because let's say you've got elevated liver function tests, which many of my patients do. I am therefore really going to care about what supplements you're taking. What if you're taking a supplement that could be contributing to that or potentially causing that, etc.? Or what if you've got cirrhosis of the liver already or other underlying problems? You see what I'm trying to say? Okay, moving on to the last one. This supplement is one that I've heard a lot more about over the last few years. The context in which I've had people asking about it is in the mental health space. They say, hey doc, will this supplement help my depression and anxiety? Because that's what a lot of people have heard about. But I recently learned that many people take it for muscle building. And of course, many of these supplements have multiple sort of claims to them as well. What am I talking about? I'm talking about ashwagandha. That's right, can potentially affect your liver. All right. So the take home point here is, what is the take home point? Take home point is that you tell your doctor all the things that you're taking. And you know what I would do? If you're taking things, you need to bring those bottles into to your doctor so they can see the ingredient list, any sort of amounts or sort of milligrams, micrograms, etc., to see amounts, to talk with you about if these supplements are appropriate. You know, if you're not able to do that, just ask your doctor, hey, can I take this? Can I not take this? Just please don't assume that it's okay. That's the biggest thing I'm trying to get across in this video, is please don't make assumptions, because the other side of this is I have seen some people run into problems because of the supplements that they're taking or the amount that they are taking. Now, last disclaimer is that this is not by any means the full list of supplements that can potentially damage your liver. No, this is just 6 that tend to come up and that have been sort of documented a bit. All right. So let me know what you think. Let me know if this video was helpful. Please share this video to other people who might benefit from it, your friends, your family, your neighbors. I'm Dr. Jen Caudle. I'm on Facebook. Please follow me there. On YouTube, please subscribe to my channel. Click the little bell for updates. I'm on Instagram, WhatsApp, TikTok, LinkedIn, you name it. Follow me there at Dr. Jen Caudle. And also, please sign up for my free health newsletter at drjencaudle.com. Guys, I'm Dr. Jen. See you soon.